Hello, I'm coming all the way from Delhi to meet Sunil sir. I came here for the rhinoplasty. Actually, I have problem with my nose. How I got to know about this place is I was doing some research online to find out who is the best doctor, and I could see very good reviews about Sunil sir. So I came all the way from Delhi to get it operated. My expectation out of it is have a very good nose.
If you come forward, the deviation is quite a lot. Axial is taking slices like this, and this is sagittal and coronal. It's really, you see the shape?
Yeah.
It's like a total C, yeah. So it's like this. So which means to say that I have to do not only a septoplasty, I also have to do an osteotomy of the nose. Only then we'll be able to correct the C deformity and make it straight. So this is very, very clearly showing us a problem inside. And that's why I said, for these kind of things, we have to take a scan so that we can change it precisely. Okay,
Yeah,
so
it's completely looking like
okay, that's the posteriormost part, behind. But as you come forward, that's a bend, and really forward is there. And so you see this shape also. See, this is shape and this shape.
Yeah.
So both have to be like this. And the septum. Septoplasty, rhinoplasty, bring it to the center, put the splint. Of course, apart from this, we need to do the dorsal work because you have a small hump and the tip is drooping. So some tip plasty. We don't have to do any alar work for you because your nose is pretty narrow. So that's not an issue for you. We just have to do the other things. So a lot of bony work, a lot of septum work, a lot of dorsal work. So we should get very good results. Now, because of this, you are going to look at 6 to 7 days of stay here, which is better. Because it takes that long for it to heal. So I'm going to be putting splints for you. The biggest concern or biggest issue the patients have is we'll keep the nose really blocked because after osteotomy, right, and then they have difficulty in breathing for the first few days. So to breathe through the mouth is dry. You'll be breathing through your mouth for the first few days, maybe 3 days, maybe 4 days at most. The passage. So when the bone is bent, what happens? The passage is asymmetrical. One side is big, one side is very less, almost blocked. But we tend to breathe from alternative nostrils, like a cycle. So because of that...
I was thinking I just have a hump here.
No, it's bent totally.
Yeah.
It's not a hump, it's totally bent. You can see very classically.
Correct.
Now the next thing is the physician part because of your diabetes. Just get that sorted out immediately and then I'll let you know about the timing. I hope he can come here before the surgery and put you on some medications, at least to get the sugar level down for a while. All right, so this is our patient. He's traveled all the way from the city of Hyderabad. We're planning a septorhinoplasty for him, as I've just explained. It's probably going to take me about an hour and a half to 2 hours because I have to work a lot around the bone of the nose, the nasal bones, and also the septum bone, and a lot of work on the tip as well. But let's work on the alar base.
Say hi.
So he has got a little bit of deviation in the nose, so we are going to correct it. So let's see the result after the surgery.
This challenging septorhinoplasty. It's probably going to take us an hour and a half, maybe 2 hours. The nose is totally deviated. The nasal bones, the septal bone, also the tip. Tip is a bit bulbous too. So I'm going to adjust that a little bit. The main work is on the dorsum, the aesthetic lines. Straight by means of osteotomy. It's a small hump, and I'm doing this by closed technique. The patient didn't want me to do much of the tip work. is a closed rhinoplasty, a cosmetic closed rhinoplasty where a lot of dorsal work, osteotomies, minimal tip work, septal work, septoplasty was done also. Show the septal harvest cartilage. We couldn't use a lot of it, but there was a lot of deviation, so this was removed. This problem with breathing has also been sorted out with septoplasty. And say rubbish. So I'm Dr. Sunil Richardson. So we have this pretty guy with us, a very nice patient of ours. Day 7, we're going to take off his splints today. He had a really deviated nose, it was bent towards his side, a lot of osteotomy, septum work, tip work and everything. So let's see how this is gonna be. I've just taken this off because that hurts for the patient a little bit. And now we're gonna peel off the steri-strip part. Okay, I'm gonna probably take it out from this side. Okay. Okay, just look down. Okay, so we just removed the splint for this patient. I'm going to show you how he looked before. Okay, you can see that this nose was totally deviated. The tip was really bulbous. The dorsum was not having a straight line. No dorsal aesthetic line. Okay, you can also show some other view there. Yeah, you can see that view, how it's bulbous and gone totally towards the left side of his face. We've removed that bulbosity and you can see a nice shape now. It's broad here, it's narrow here, it's broad here. So the nice dorsal aesthetic line is there, it's complete. We've got a nice sloping curve on both the sides that leads up to the dorsum. Haven't done too much with the tip, but still it's a little bit reduced from the pre-op. It was a closed rhinoplasty and you can see the shape of the nose. And so this is early days for him because a lot of bony work, and I'm going to put him on splints again, especially steri-strips, and those are going to stay for a couple of more days. Even longer is better, maybe even 5 days is good enough. And show me that. Yeah, another one. So you can actually see both in your just show it to him, let him see in the mirror, not like that. So he can see both his face and the pre-op on the mirror. You show it to him so that he can, he can see the mirror and see. Can you see both now?
Yeah.
So you see this tip also, like I said, we've not made it really narrow, but it's definitely narrowed than earlier. And this is still lot of swelling. Okay, once the swelling goes.
This part?
No, this part. I have not done much for your base. Okay, the surgery is mainly here and here.
Okay.
And inside on the septum and on the tip. So here there's no swelling. You know, we haven't done anything for the alar base for you at all. But for the tip, septum, dorsum and both the sides, osteotomies and work here, lateral, medial, both osteotomies. So that's why that is like that. And if you see here, look at this pre-op and it's not projected there. Your nose is starting much lower, it's starting higher now. And then it's broad, just narrows and then again widens up. And this is a nice curve that comes from the eyebrow. You see that's not there now. It's breaking. A lot of issues, lot of changes. I think it's
It looks straight now.
Yeah, it's much better. So like I said, we're going to put the splint for you, the steri-strips for you. Okay, in this position. Keep it for a few more days. 5 or 6 days later, we can take it off, and then I think
All these will go, right?
everything will go. I'm going to take those off right now. No scar will be there.
How about this one? This looks a little bulgy, no?
So it will be little bit more, look in the mirror, it will be little bit more swollen here than here.
Okay.
It won't be same width there. This will be little bit more than this. See, that's when it looks nice, like a reverse triangle there. If it's narrow there all along, it won't look nice. It will be little, it's of course, now you see there's still swelling. You can feel that, right? You can feel it's still swelling, and you know, it can be there for a long time. So for total healing, 4 weeks, 5 weeks, even for you is fine.
So once the swelling is gone, then
it will come down.
A little more different. No?
It'll look a little bit more nicer, especially around the tip, and this will get more finer. Now still broad, so show that once more. Yeah, you can show the side views also maybe, or show the front view only. Yeah, let him just show another front view. Yeah, show that. That's a lot of improvement. That's nice actually, it's very nice now. And if you notice here, there was a depression there, right? And there was a small hump.
Yeah.
None of that will remain now because I've used auto spreader grafts and we've done dorsal onlay. So both of that will take care of that, okay? And then there's a bulge here, the whole nose is moved towards the left side. And that's why both the side osteotomy and bodily movement of the nose in the midline. Okay.